Babies born prematurely can have major health setbacks. That was the case for Ezra Campbell, who was born at 25 weeks. But a team of doctors and specialists at community medical centers helped him grow to be the thriving 3-year-old boy he is today.
Can I listen to you? Can I listen to you fast?
Dr. John Moolah and 3-year-old Ezra Campbell have become fast friends.
Here is Ezra's face.
On this day, Ezra gave Dr. Moolah one of his T-ball cards.
Thank you. Good job, man. Look at you. You are precious.
But life hasn't always been so fun for Ezra. He was born at 25 weeks. Mom, Sara Campbell, explains how high blood pressure during pregnancy sent her into an emergency C-section.
My blood pressures were like 250 over 120. My kidneys were shutting down. They thought that they were going to have to deliver Ezra for my health.
When Ezra was born, he weighed just 1 pound and 6 ounces and could fit in the palm of your hand. He was immediately brought to Community Regional Medical Center's neonatal intensive care unit.
Going to the NICU for the first time and seeing him was overwhelming. For sure.
Dr. Mullah is a pediatric pulmonologist with UCSF Fresno and the medical director for the Pediatric Specialty Center at Community Regional.
Good job. High five.
He explains Ezra's organs were not fully developed. His underdeveloped lungs pose the most health risks.
He was on a mechanical ventilator. He was intubated. We were also doing echoes of his heart, and he had pulmonary hypertension. He was already on medications for that, and he was dealing with also nutrition issues, weight gain.
Baby Ezra could not breathe on his own. He was flown to UCSF Medical Center for a tracheostomy. A temporary airway was placed in him so he didn't have to use his mouth or nose to breathe.
They had to put him on medications and on breathing treatments and on a ventilator to help support him and on oxygen.
When Ezra returned to the NICU at Community Regional, Dr. Moolah and a team of specialists continued to care for him.
We've got multiple different subspecialties. At that time we had pediatric cardiologist that was involved, the pulmonologist was involved, neonatology was involved. We were able to do echoes in the hospital.
With the help of each doctor, nurse, and medical staff, things began to look up for Ezra.
I really feel like it's been a team effort to get Ezra as far as he has come. From that little tiny baby that barely looked like a baby to the very active 3-year-old that he is today.
Even when Ezra went home, he continued to be cared for by a variety of highly trained specialists.
On the outpatient side, you always have the pulmonologist, you have a nurse, you've got a respiratory care therapist, you've got social worker, dietitians, a whole set of team on the outpatient that really truly cares and is dedicated to these patients.
Dr. Moolah says he's very grateful every patient like Ezra can receive multidisciplinary care.
Our care is really around the patient. It's truly patient-centered, family-centered care.
Today, Ezra can breathe on his own. Dr. Moolah says it's extremely rewarding to watch Ezra grow.
Ezra is going to continue to grow. His lungs will develop, and he will, become a little boy as you see already. But he's going to continue to grow, and he'll do just fine.
Sara calls her son her miracle baby. Despite health setbacks, she says she couldn't be more proud of his perseverance and growth.
He has just really shown that even with tubes and all of these limitations, that he has just a happy life, and he is willing to take on anything that life throws at him.